And I guess that also comes up to side effects, right? Do you see a lot of side effects with the IO agents in liver cancer? I mean, we talked about their underlying liver disease. Do you have special concerns using these drugs in a population with underlying liver disease?
Well, I think at a high level, one can say that the adverse event profile of nivolumab and pembrolizumab in HCC was no different than the adverse event profile of these agents in other tumor types. So that's actually important to mention. There is particular concern about liver function, again, in patients with HCC. So one has to pay attention to AST/ALT elevations, bilirubin elevations, and again, make a judgment whether this could be potentially autoimmune driven,
right,
where an intervention would be needed with initiation of steroids. So generally, what we try to do is make sure that this is not due to the elevation of the liver enzymes or bilirubin is not due to progression or other external factors. And if not, one has to assume that there may be an autoimmune process that's driving this, and steroids may be indicated for grade 3.
So another reason to involve the multidisciplinary approach, not necessarily only for treatment decisions, right, but managing toxicity, right?
Absolutely.
Yeah.
And also one has to watch for other known autoimmune complications with these IO agents, which could occur in the setting of HCC
disease,
as well.
Diabetes. Yes. And as long as we're talking about toxicity, you know, with regorafenib, I think its side effect profile, for those of us who have worked with sorafenib for so long, are probably pretty comfortable managing that. I mean, there's a little more hypertension, but hypertension with the TKIs tends to be manageable, either with calcium channel blockers or ACE inhibitors, things like that, diuretics even for the liver population. You participate in the cabozantinib studies. Do you have any insight to that, or the fact that it overlaps with sorafenib and regorafenib? It's generally a similar side effect profile?
I mean, it's largely a similar side effect profile, and I think the message is consistent with all these TKIs. I think practitioners have to be good at educating their patients about the potential toxicities, practice a lot of what I would refer to as maybe prevention or early intervention, your topical urea creams for hand-foot, education about diarrhea, diet changes, loperamide initiation.
And seeing them frequently, right? I mean,
and see them frequently.
You know, these are oral anti-cancer drugs, especially for people who aren't used to working with these drugs. You can't just give them a prescription and say, I'll see you back in 3 months, right? Absolutely. They need active monitoring so early interventions can prevent things.